Hi, I'm Charles Ginsberg, and welcome to the C. Jason podcast. I'm a nephrologist at the University of California, San Diego. I'm accompanied by two of my colleagues, Dr. Joachim Ix and Dr. Rakesh Malhotra. Joe and Rakesh, why don't you introduce yourselves?
Hi, I'm Joe Ix. I'm the UCSD Nephrology Division Chief, and I'm also very interested in mineral metabolism.
Hi, I'm Rakesh Malhotra, also a nephrologist at UCSD, and I'm interested in microvascular disease and dysfunction.
So let's talk a little bit about our work on phosphate and microvascular dysfunction in Maastricht.
Okay, well, this all started when we noticed some emerging in vitro mouse and human studies demonstrating impaired vasodilation of the vasculature when exposed to high phosphate concentrations.
Yes, and in a recently published study, participants were randomized to high versus low phosphate diet, and the high phosphate diet group experienced a rise in blood pressure, and this led us to speculate that perhaps this blood pressure rise was due to impaired microvascular function from phosphate exposure.
That's where the Maastricht study really provided value to us. In the Maastricht study, there were direct microvascular measurements of over 3,000 participants. They used skin capillaroscopy, retinal vessel dilation, and laser Doppler flowimetry to assess the microvasculature. We then measured serum phosphate concentrations in this cohort so that we could assess the association between serum phosphate and microvascular function using these techniques.
So sure enough, we found that a higher serum phosphate was associated with impaired microvascular function in this cohort. This was especially interesting as this was a relatively healthy cohort with minimal kidney disease and serum phosphate almost exclusively in the normal range. We believe our findings suggest further work is needed to evaluate the mechanism of this association so that we can optimize microvascular function in all of our patients, not just persons with CKD or hyperphosphatemia.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.